Good morning, everyone. Welcome to the European Policy Center. My name is Elizabeth Kuiper. I'm Associate Director here in the European Policy Center. And it's a pleasure to have so many of you, also familiar faces here in the room, but also, I think, 20 plus colleagues online for an event which is very much going to focus on navigating the future of European healthcare. And it's really one of these topics, AI in general, but certainly also health, where you see that things are changing on a daily basis. There's really very rapid developments when it comes to the evolution of AI and health. So today we're going to examine how AI is transforming the European healthcare landscape from research to delivery. This event is a part of a series in the context of the Coalition for Health, Ethics and Society, which is kindly supported by Johnson & Johnson. And the idea for this event really stemmed from a more closed-door roundtable session that we had last year. And it was just after the Commission presented its guidelines for the 24-29 mandate, where, of course, the role of innovative technologies for the EU has been stressed very much, but also where healthcare has been identified as a key vertical for European technological competitiveness and societal resilience. And especially back at that point in time, I think it must have been just in September last year, we said that really this discussion about AI and the role of data in healthcare more broadly warranted a more in-depth conversation, where I think also for today, we're going to touch on many different angles, because again, it's a vast topic, I think, per se, but also AI and health, there is a lot of focus that warrants a more in-depth conversation. And I think if you only look at the practical implications of how the different regulations coexist, if you think about the AI Act, the Medical Devices Regulation, the European Health Data Space, but also the general pharmaceutical legislation, where we still have ongoing negotiations, it makes you realize that the regulatory framework is very important. And as we said with a few speakers in advance, especially with a field where technology is developing so rapidly, it's very hard to keep up with the speed of regulatory developments. So certainly one of the questions that we're going to deal with this morning is how to do exactly that, how to impact the development, but also the deployment of new solutions in the space of AI. Also by examining the opportunities that indeed stem from the Apply AI strategy and the AI Continent Action Plan. I think it's also very important, and therefore it's also good to see that we have some speakers with more international background to position Europe in the global AI landscape. And therefore we also discuss how to achieve greater international regulatory development and alignment, but also I think the question about AI and trust in data and how an AI-assisted healthcare system looks like, not just for patients, but also for clinicians and for regulators. And just yesterday, I was moderating a discussion about women's health. And also there, the topic came up that, for example, for women's health, we structurally lack data. So how can you deploy AI when you have limited data? And how do you ensure that indeed bias doesn't perpetuate if you don't have the right quality of data? So also the question about trust and data is very important, and I'm sure that we're going to touch on this in the panel discussion this morning. But a third element, which is equally important at a point in time where we focus a lot on Europe's position in the world, the EU's competitiveness and its ability to innovate, is of course how to ensure that we get a Draghi-inspired AI vertical, because Draghi very much pointed to the fact that the EU as such may not be winning the global race for AI, but there are certain sectors, including health, pharmaceutical, and biotech, where certainly the EU is very well positioned to come up with an AI for health vertical. So today we also explore indeed how that looks like and how we can overcome the fact that the EU is very often at the forefront of research and innovation. However, the transformation to deploy these technologies and to translate these into innovation and to scale up these innovations, that is a challenge that the EU very much faces, including in healthcare. So I think these are just a few elements that we will touch on in our panel discussion later this morning. We have a lot of speakers with very important experience that I bring to the table, so I really look forward to moderating the discussion. But first, I'm equally happy that we have Jean-Marc Bourez. You're the CEO of EIT Health. So you will deliver a keynote speaker on the EU's role in the digital health R&I ecosystem. And it's really importantly that you bring that perspective from a leading innovation hub that connects research, education, and business. And I think that's exactly the sort of angle that we wanted to take for this morning, because an ecosystem where all these different stakeholders work together is very important to advance the AI in health landscape. So Jean-Marc, many thanks for being with us, for coming all the way from Munich, where EIT Health is based. And I would like to give you the floor for your keynote, which will be followed by the panel discussion. Thank you.
Thanks a lot, Elizabeth. Really appreciate it. So, good morning. I'm really delighted to ensure this introductory words regarding this panel discussion. So, it's a great privilege to open today's dialogue on the EU's role in the digital health research and innovation ecosystems, from research to delivery, with a special focus on artificial intelligence in health. So I want to thank the European Policy Centers and CHESS for convening us at such a pivotal moment. We stand at the crossroads where health policy, data governance, and technological innovation are converging, and where the decisions we take today will shape Europe's health resilience, competitiveness, and sovereignty for years to come. Digitalization and artificial intelligence is basically reshaping healthcare, from diagnostics to drug development, from patient pathway management to healthcare operational efficiency. For Europe, this is not just, let's say, a technological opportunity, it's also a strategic imperative. To remain competitive, you make a reference to Draghi's report, which is an amazing report so far. Europe must become a leader in ethical, high-impact AI applications in sectors like health, biotech, and life sciences going forward. European frameworks like the AI Act, the European Health Data Space provide a solid foundation, but we must ensure that regulations enables, not hinders, innovations going forward. Key priorities include federated data infrastructure, AI-ready public procurement, including public procurement of innovation, digital skills for the health workforce, whether it's about healthcare professionals or industry workforce, from startups to large corporate industry actors, but also harmonization of health technology assessment, methods for artificial intelligence in health applications across border, and support for responsible testing experimentation facilities like TEF Health in AI and robotics, or for like AI factories or digital health hub going forward. So let's go through a couple of considerations to opening the dialogue during the panel discussion. First, I would like to focusing on the opportunity that AI is gonna bringing to the different kind of stakeholders across border as a lever for transformation and competitiveness. So artificial intelligence is not just another tool in the digitalization toolbox. It's a general purpose technology with the power to redefine the healthcare value chain, the entire value chain, from research to clinical trials, from diagnostics to patient engagement, but also from hospital operations to policy making. At EIT, we see the momentum building across our innovation ecosystem. AI is being used for accelerating drug discovery, but also drugs repositioning with generated models or federated AI approaches by tapping into a set of data across border, enhancing clinical decision support with real-time diagnostics technologies, but also optimize care pathways as using predictive analytics. And last but not the least, somehow democratize access to digital therapeutics and virtual triage. These innovations are basically don't just improve care, they unlock new business models, but also talent pathways and strategic positioning for Europe. As the recent AI continent action plan rightly notes, Europe's global competitiveness will increasingly hinge on its capacity to lead innovation and in mission-driven, trusted AI, especially in high-impact sectors like the health sector, biotech and life sciences sector. So in a nutshell, let's be clear. I mean, the health AI race is global. while the US dominates venture capital and deployment, and China scales through their national platforms, Europe must carve out its own path by rooting in ethics, clinical excellence, data-driven innovation that serve both public value and economic competitiveness, as you can imagine. So the policy environment. So when it comes to the policy environment, so we now have a growing regulatory backbone, the AI Act, which introduces a vertical risk-based approach with special attention to health application. The Open Health Data Space, designed to facilitate secure secondary use of health data for research and innovation, but also public health and policy making. And the medical devices regulations, including GPL revision and EMEA AI work plan, which are increasingly aligned with the needs for real-world AI deployment across member states. This architecture is necessary, but it's not sufficient. Regulation must become must not become a bottleneck, so to say. It must be an enabler of responsible innovation, encouraging experimentation, adaptive governance, and rapid translation of scientific breakthroughs technologies into scalable innovations, giving access to the market. This is why initiatives such as regulatory sandboxes led by IHI, Innovative Health Initiative, or TEF Health in AI and Robotics led by La Charité in Berlin, or AI factories are so important. They provide the infrastructure, but also the mindset to, let's say, reconcile risk management with speed, agility, compliance with creativity. On top, addressing the skills gap is crucial. So, Elizabeth, you made a reference to education, that's all the knowledge triangle so far. And obviously, the skills gap is really a key driver to address those expectations. And basically, the Union of Skills, which have been announced a couple of months ago, is going to tackle this challenge going forward. So, from platform, let's say from patchwork to platform, building an AI-ready Europe, to truly lead in AI-enabled health innovations, we must move from a patchwork of pilots to an integrated platform for scale. That means empowering AI developers and startups in the field across member states with access to compute power, real-world data, and innovation funding. Whether it's about grant, private equity financing, venture debt, or guaranteed loan that are bringing specific support to startups and SMEs across Europe. Creating a federated and interoperable data ecosystems is a must, so that algorithms are trained on diverse, high-quality data that reflect our populations and our diversity across member states. Last but not the least, I mean, modernizing public procurement and reimbursement system as well, whether it's about pre-competitive procurement of innovations or public procurement of innovation. Basically, also going through a value-based procurement of innovations, tapping into a set of data that are demonstrating the medical value for the healthcare systems and for the entrepreneurs, so that hospitals and health systems can adopt innovation that reflect our populations, and with bearing in mind all the risks that are linked to the development of such a kind of technologies. I'm investing in digital skills and leadership across the health workforce, whether it's about healthcare professionals or industry workforces, is a must-be, because a clinician confident in AI is a multiplier of value, not a bystander. So when it comes to technical skills, why technical skills related to coding, programming, and machine learning are common? Startups that combine them with sector expertise, such as in healthcare, biotech, life sciences, engineering, or manufacturing, and broader skills, are linked to stronger regional innovation output. In contrast, regions relying only on general IT skills are falling behind. This observation will be published soon, so it's somehow a kind of a breaking news. We are going to publish a new report co-authored by EIT Health and EIT Digital, part of the ecosystem of the European Innovation Institute of Technology. So the name of this report is going to be published like AI skills and occupations in the open startups ecosystem, is basically analyzing the largest live data sets of AI startups in the field, including the startup talent in Europe. And it's basically examining the skill profiles of over 23,000 professionals across 4,000 AI-focused startups in Europe. The findings are sourced with using eHealth's Skills Sync platform, which is an AI-based technology solution. It's a specific tool which has been co-developed by EIT over the last 3 years to benchmark and forecast the skills needed to drive Europe's AI economy. The report cross-references these skills profiles with the European Innovation Scoreboard to highlight which workforce capabilities are most strongly linked to innovation performance. So in a nutshell, over-relying on general IT skills doesn't correlate with innovation's performance, suggesting a need for more broader scope of skills beyond baseline digital literacy towards more advanced sector-specific skills capabilities. So, a call to action. Europe has made the ethical bet. Therefore, we can lead in human-centric, explainable, and high-quality artificial intelligence solutions, especially in the sensitive domains like health sector and life sciences. But ethical leadership must be backed by technical and technological capacity. Capital flows, whether it's about capital risk, grant or venture debt and guaranteed loan, and policy coherence. Otherwise, we risk becoming the global referee in a game played by others. What we know needs is a kind of a concerted effort to align regulatory frameworks with real-world innovation cycles, incentivize cross-border and cross-sectoral data sharing, and support health AI champions from SMEs to hospital innovators to public agencies experimenting boldly those kind of advanced technologies going forward. And elevate health AI as a pillar of Europe's industrial strategy, not just its research policy. So I would like to close with this thought. AI will not replace healthcare professionals, but those who embrace artificial intelligence will redefine healthcare and innovation in life sciences. Our role as policymakers, as innovators, as regulators and practitioners is to make this transition intentional, inclusive, and impactful. Let's seize this moment to turn Europe's value into Europe's advantage and make digital health and AI a story of innovation with purpose. Thanks for your attention.
Many thanks, Jean-Marc, for setting the scene so well. I think you made a very important remarks there, I think that will inspire our conversation just now in the panel. I think especially what you said, and I noted that down, the fact that AI is not just another tool, but it's really a general purpose technology. I think that's very important. And also indeed the importance of scaling it up also from patchwork to platform. I think that was a very nice soundbite that you integrated in your opening remarks. So yeah, I think that really is a very good starting point for the panel that we're going to have. I think breaking news is always good to be included. So I'm sure that we're looking forward indeed to your new report, and that indeed also all of you in the room, I think, noted that, I think, as a mental note to see indeed when the report will be published. So with that, indeed, thank you very much, Jean-Marc. I hope that you can also stay for the rest of the discussion. But with that, indeed, I would like to move to our panel. And we have quite a few distinguished speakers. And as you probably know, at the EPC, we don't like static discussions. So while I'm very keen to listen to our speakers, I also would like to call on you to come in, because it's always much more interesting if also the room comes in. So everyone really prepare your questions. And I won't only go to them at the end, but I already will come to you just in between the questions. So just so that you know that we aim to have an interactive discussion. So with that, can I ask our speakers to come to the podium, and I will then indeed announce your name. So we have Fulvia Raffaelli. You're the head of unit for digital health, DG SANTE from the European Commission. It's great to have you. Perhaps I will take the left seat. So perhaps keep that one. No, perhaps, yeah, if the rest can take the other seats, I'll have also a place for myself as a moderator. Thank you, Fulvia. Then we have Kyriacos Hatzaras. You're also from the European Commission, but you are from DG CNECT, Program Officer for eHealth, well-being and aging. So Kyriacos, it's great to have you as well, because as was clear from Jean-Marc opening remarks, really AI and also AI in health, I think, is a topic where many parts of the Commission are involved. So it's good to have the two of you representing the more broader Commission view. Martijn, Oldenhof, it's also really important to have you with us when it comes to indeed the broader ecosystem that the Commission is now working in, the infrastructure for AI in health, because you are representing one of these lovely EU abbreviations, because your abbreviation is that you're the Program Officer R&I for the EuroHPC GUI, which is the European High Performance Computing Joint Undertaking. We love abbreviations in Brussels, but I thought to set that out more concretely. Then we have Hammad Shahid from Johnson & Johnson. Hammad, it's really good to have you here as well. You're head of the data strategy at Johnson & Johnson, so it's also really important to have your perspective on board. And Simone Mohrs, it's really important to have you as well, because you are representing the Guild, and that stands for the Guild of European Research Intensive Universities. So it's also really important to have that academic perspective. And for those of you that are familiar with EPC, we always on purpose choose to have many different perspectives, multi-stakeholder perspectives. And I think especially on AI, where I think collaboration between all these different perspectives is so important, we felt it was really important to have all of you indeed engaging in this discussion. So as I said, please come in. We also will witness and monitor the questions online. So with that, I look forward to our conversation. Works. Tatjana, can you confirm? Super, because especially, and I think that's also a practical note for our speakers, since we have colleagues online, please do use your mics, because otherwise they will not be able to follow the conversation. Fulvia, let me start with you, because I think it's already for a long time, of course, that DG SANTE has been very much involved in discussions about about health and data, and then more recently also AI, of course. So that was a Freudian slip of the tongue. But I think especially since indeed you have been involved in the European Health Data Space negotiations, I think my first question is to you and to sharing your vision and then DG SANTE's vision about how the European health data space will interact with AI-based healthcare technologies and tools. And I think the background for this question as well is that in my opening remarks, I refer to the speed of development in this area. And just the other day, I was reading, I think it must have been a report from SANTE, stating that the implementation of the European health data space is probably within 4 to 6 years. And we're speaking about AI, where you see that technology is developing very quickly. So how do you ensure that the vision that isn't captured in the European health data space also keeps track with the developments in AI more largely?
Well, first of all, good morning, and thank you for inviting me. I think this discussion is very, very timely. As you said, SANTE is at the core of that conversation. And let me say why. I mean, because AI, it is, as it has been said before, a general purpose technology that would actually has the potential to transform the healthcare sector. But is also something that can that needs to be looked at to. It needs trust to actually add that potential and deliver that potential of transformation. The healthcare sectors is a sector that is facing many challenges. I don't need to tell you how big they are in terms of course, aging population, increasing chronic disease, and many other shortage of workforces. And we see in AI a real potential to actually support the uptaking, the change, the modernization of the healthcare sector altogether for the benefit of the patient. But that requires trust. And trust is what we are trying together to build up, the European health data space being a very important piece of that puzzle. Yes, because if AI is a general purpose technology, as has been said before, data are not a commodity. Data are really something which are it's just precious, and it is private, and we need really to get the trust of the patient in first place, and even broadly of the citizens, because the big change of the European health data space is that we're moving from, let's say, from a collection of data, which is based on cohort or in trials, in many, but small lists, even if big, still small representatives, to a population-wide potential data source. But to make this change, which is future-proven, because you said we need to keep up with innovation. Yes, and in this area is very difficult. But if you look at the European data space, you see that this is really not only a future-proof, but a sort of a pioneering vision, because it's really preparing the ground for this incredibly large needs of data that is needed actually to really develop an AI which is fit for purpose. You mentioned in your introductory statement the fact that data are today, data from research, still biased because they very much, as I said, based on relatively small cohort-based. They are the data which are collected in hospitals at the day, I mean, most of the days. And in hospitals, first of all, you have the people who are sick. Then you have the people which is having also, in many cases, more let's say, age than the average of the overall population. So the data are not reflecting the reality of the population. And historically, data collected are more on men than on women, in fact. When having this vision of the European data space that moves and create the condition for making data available at population scale, we had somehow anticipated that needs, and we're preparing the ground for the actually rolling out of those very specific technologies in AI and building on trust. We'll be able to keep up with the innovation and with the speed of the technology changes in that area. I hope so. Yes, the obligations will be, the regulation has been entering into force end of March, and the obligations will start applying in 2029. So indeed, it is 4 years for AI developers. It looks like a century, but we are not starting from scratch. And of course, we are building upon the experience that we've been doing together with the colleagues in DG CNECT. So really, we are building by day. I mean, we're not starting absolutely not from scratch and not reinventing the wheel as well. So all this experience that we've been gathering together at Commission level and the European with the AT as well, very much, it will be part of it. So we do our best to catch up. But as I said, I think it's important, the work we're doing in the European health data space, but all the different projects that we are building together, it is about creating the good and a solid foundation for DI to be at the service of the healthcare sector, at the service of the citizens, at the service of the patients, and of the society as a whole.
Thank you very much, Fulvia. I think perhaps one follow-up question before indeed I go to Kyriacos, because I'm also very interested to hear your view and how indeed your different angles come together and what the Commission does. But indeed, when it comes to trust in data, you mentioned bias, the fact that indeed when it comes to medical records, not all let's say medical relevant details, for example, on women's health are included. That's, I think, an example that speaks for itself, and also I think for the audience reflects indeed what kind of bias that may be created in health. But I think especially from an EU perspective, I think fragmentation is probably another issue that needs to be addressed, because just this morning I was reading that in the UK, for the first time, apparently a generative AI model trained on medical records of the NHS had been developed, but that's based on 57 million people based in the UK. And I think the reality in the EU is very often that indeed healthcare systems are so different in form and shape. And I think we have seen that during the negotiations of the European health data space. If you compare, let's say, a country like Germany to Finland, these are very different realities. So when it comes to, let's say, the quality of data, how do we overcome this fragmentation, especially when we move from data to AI-driven systems?
Well, this is one of the objectives of the European data space by creating the digital infrastructure that will make will provide access to data for secondary use. The HDS is providing, well, first of all, a very harmonized process so that it gives all the guarantees to identify the users and the uses that we want to allow and not to allow. So that's also been a very, very close, a very strong, let's say, point during the negotiations, the list of uses which are allowed and prohibited. So we have a very clear structure processes to access the data. And then via the HDAP will also make, first of all data holders will need to make known the data they have. And this will improve by default the readability, visibility, and findability of data. Then with those data will become available upon decision of the HDAP in the secure processing environment for the researchers and will be combinable across the member states, things that today is very, very, very difficult. So the HDS made already this very first step. And then don't forget that we are via the primary use of data and the identification of the primary categories, we are somehow already setting standards for the data as source for the first priority categories. So, and then you also working very closely with the initiatives that have been initiated under the CNECT colleagues, very important initiatives such as the 1 million genomic or the cancer images, where actually the work that has been done in that area, really to push standardization of data for research will be actually captured and completely make it even more visible and more accessible via the HDS. So as I said before, the HDS will really largely improve the current conditions. Is not the silver bullet, so the situation will not change from one day to the next. We need time, but at the same time, it's really in creating the conditions for that fragmentation that you mentioned before to become to be overcome in the well, quite in the short medium time, not very long.
Well, thanks, Fulvia. And I think indeed, Kyriacos, let us turn to you now, because given what Fulvia just said about the focus of SANTE and the Commission at large, how do you ensure coordination where probably DG CONNECT that you represent is probably more working on the innovation angle? And how do you ensure a cohesive, not only coordination, but vision between the different parts of the Commission?
Well, it's a very good question, Elizabeth. So very simply expressed, as Fulvia said, while our colleagues in DG SANTE are preparing the ground, we are already supporting innovation through the deployment of infrastructures. So this has been quite visible recently with the launch of the AI factories, but also when it comes to the health infrastructures. In essence, we have been working on these really key priorities for European healthcare since the end of the last decade. So first, with the launch of the 1+ million genomes initiative, then with the launch of the initiative, and more recently, focusing on even more advanced technology for the benefit of practitioners and first and foremost the patients. We have launched an initiative on the advancement of human health and disease modeling and simulation in Europe, the so-called virtual human twins initiative. So in essence, it's a hand-in-hand process whereby the legislative framework has been advancing, but at the same time, we do need infrastructures. It has become very clear that the AI cannot come to fruition and cannot quite develop in the Union without the deployment of public infrastructures for the support of SMEs, research, our researchers, innovators, and others. And we're very happy to see that as part of the initiatives mentioned, which will be further supported now through the operation of the AI factories, we are seeing partnerships, collaboration across the member states and across the stakeholder groupings that I just mentioned.
Well, thanks, Kyriacos. Before indeed I go to you, Martijn, about the AI factories and learn more about it, let me see perhaps in the audience if at this stage there are already questions or remarks. Anyone who would like to come in? If not, perhaps, Simone, let me first turn to you, because again, before we go into the infrastructure, I am keen to indeed delve a little bit more into the European health data space. And I know also from a university, from an academic perspective, you're probably also involved in the thinking about the secondary use of data. And I think especially if we speak about trust in data, secondary use of data is very important, because you will have indeed many different stakeholders involved with different interests at the table, to put it that way. So how do you see that? What's the vision of the guild that you represent? It works? Does it work?
Okay, so hello everyone. Thank you again for having me. So maybe the Guild is rather a new stakeholder in this field now. So maybe I give a quick introduction of what the Guild actually is. So we are a university network, a European university network of about 22 universities across the European Union, but also in countries such as Norway and Switzerland and the United Kingdom. And so we represent the interest of comprehensive universities in health research. And so as such, we work, or I myself work very closely in the field of the European health data space. So it's a really big honor to be here. And also thank you for the question and having us representing the researchers, because it's from what I've heard in the previous discussions, researchers were not really mentioned as well. So thank you for putting the researchers out there. I'm always eagerly to listen that you have the industry and SMEs and researchers. So it's the pause that always gets me on the toes. So in terms of the European health data space, we've been following it for a while now, and I'm really glad. And again, congratulations, Fulvia, for stemming this very important piece of legislation. What we, of course, are very not concerned with, but very closely following are the implementation for the secondary use of health data, because obviously we have been conducting health research for way before the European health data space has been actually an idea of the European Commission. And so our main area to see where it will go in the future is what will change for us, what will change for the researchers that are not necessarily following EU law or EU developments. And this is something that we are now also developing within our network, is similar to what you within the Commission have done, an FAQ document, where we really give answers to questions that we hear from our researchers of like what, a really simple example, what are other scientific publications, because it's not defined. So I got a reply from your colleagues, so all good. But so we have this kind of very simple way of explaining the European health data space for our researchers. So we're conducting that right now, but we're really looking forward to the guidelines, especially on the secondary use of health data and the implementing acts that will further define, for example, the quality of the data that we can use and what kind of guidelines and what kind of steps we have to take. Another important aspect that we see and that really needs to be really further refined is how can we collaborate with researchers and universities that are outside of the European Union, because the implementation part there only is from 2035. And so, of course, we don't really want to sit on our hands to have this, to see what will develop. So this is one of the big things we really try to have a good discussion between our universities from within the EU and those that are outside the EU to continue the collaboration that we have been doing in the past very well. So that's the main areas that we see. Otherwise, again, the webinars, I don't know if you have now plugging this in as well, the webinars are very great to have a better understanding. So I also forwarded this to our universities. And if I actually have a question to the Commission, since I have here the microphones, very nice. My big question is, how is the health data access body training or providing training opportunities for researchers that want to use the secondary use of health data through the European Health Data Space? Are the HDAPs providing training for researchers? Is that the role of the universities? How will this look like in the future? Because the provisions for the task of the HDAP are not necessarily that defined. So I didn't want to take the role of the moderator, but it would be great to hear.
Feel free, Fulvia, perhaps to come back to that first before we go into the infrastructure. So perhaps need Kyriacos, if you could share the mic.
Yes.
And of course, if you want to come in as well, I mean, feel free to do that after Fulvia.
Well, first of all, thank you very much, and I really hope that HDS will improve your your situation. I didn't mention the researchers because, of course, well, from a SANTE perspective, you know, we always have the first reaction to think about patients and citizens. But it is true that absolutely true that the research is a big objective for the HDS to improve. Also, because of course, the research is part of the patient journey. I mean, that's where we think so that the researchers are really the future, is the ones that are going to use the data for the purpose. And I think again, well, I'm coming to your question, but let me also say that that's why also the trust is so important, because we need to build the trust in the citizens that research will work for them. You know, that at the end, this is something that we are working together, and their data would be indeed used for research of innovation that at the end will will bring benefit to the society. For the very specific question you had on HDAP, it's true that there is nothing specific into the regulation, but there is we expect the HDAP to be active also in the capacity building. So this is specifically mentioned into the regulation and in communication. The work that the Joint Action TEDAS is actually doing is also creating and developing a lot of guidances for the different stakeholders. By the way, they will be in public consultation very soon. So don't miss that opportunity to contribute. They are developing very different building blocks for communication. Now, the communication is not the easiest part of the HDS, because as you mentioned, member states are very different from each other. They have very different level of maturity and also very different level of trust in public, let's say, in the public health sector, but in the governance in general. So there we need really a very important reflection on how to communicate about the HDS to the population and also to the different stakeholders. It's easier to communicate to the researchers than to communicate to the citizens, definitely. So for that, I'm sure we are already having a contract on communication that will develop small building blocks for the different stakeholders, so that member states can actually take up and multiply. This is the work we will basically doing from 29 to 2031. Sorry, from 2027 to 2029. So just before the obligation enter into force. Now we are full speed on implementing it. That's our main priority for the next 2 years. But also for that, we rely very much indeed on this public consultation, the stakeholder forum, and having the meeting on the 21st of May, so that we take all these needs in consideration from day one.
Okay, I think another important date for the audience to know, the 21st of May. So not only an EIT study, but I think an upcoming event as well on that date. Did you want to come in, Kyriacos? Yeah?
So just to say that researchers are a very important constituency for the Commission at large. So for DG Connect, DG RTD and others. And essentially the message is, indeed, while we are preparing the new legislative framework, please make use of all the available opportunities for advancing scientific research in Europe as they stand, and there are very many. Thank you.
Well, I think that brings us to the question. I think, Martijn, then indeed we come to you. When we speak about infrastructure needs, and needs not just for researchers, but I think for very different perspective, I think infrastructure needs are very important. But perhaps can you explain indeed how AI factories come in, and what sort of capacity, but also capabilities they bring that we currently don't have in the deployment of AI healthcare-driven systems?
Thank you for inviting me. So let me first introduce myself. So my name is Martijn Oldenhof, as already mentioned, and I come from my background is I've been working in AI research, applying AI for machine learning. I mean, applying machine learning for drug discovery and drug development. And I just recently joined EuroHPC with that background. And EuroHPC is an organization or a joint undertaking that is pooling resources, European resources, to put Europe in the front line in supercomputing. And in that area, AI factories has been introduced, of course, like I already mentioned. But I think besides the infrastructure, what is also important here is that AI factories is also a network, a European network of supercomputer centers that form kind of a AI ecosystem where, I mean, we also have not only the infrastructure, but also the human beings in the background of these data centers that actually make everything work and make it possible to run these AI models on the data centers. And I think this is also a very important aspect that needs to take into account to have a European network where skills can grow, startups can easily contact computer centers. And in that area, we also recently opened the call AI antennas. And there, because now I think we're in the process of rolling out more than 10 AI factories over the member states but not all member states have these AI factories. And that's why there's also this call of AI antennas, where if you're a part of a member state where you don't have this access, or where you don't have this AI factory in your member states, we also would like to have this AI antenna network where a member state can collaborate with AI factories or an existing AI factories, and that where SMEs, researchers can just knock on the door very closely to get support and to easily get access to this infrastructure. That's a little bit the nutshell.
Well, thanks, Martijn. I think that's also a very important point, and I think it brings us also back to inequalities that we also started the conversation with, because I guess in terms of regional development, that also will be very important, that different regions in Europe also have the possibility and ability to catch up in that respect with the network as such. Let me see if in the meantime there's any questions. Yeah, there is. And the mic is coming your way. Perhaps if you could just briefly introduce yourself.
Thank you, Dariusz Adamczewski, Children's Tumor Foundation Europe. I represent two different realities. On one hand, research foundation that is in the between researchers, industry, and patients. And on the other hand, I'm everyday physician and practitioner. And it's generally comment, not a question. So on one hand, I'd like to express my appreciation to especially European health data space, because in the rare disease community I represent, it's very important to have access to federated data that are currently in silos, and really this across Europe, European access is very, very important from the perspective of everyday clinical care, but also drug discovery, diagnostics discovery. But on the other hand, I'd like also to highlight the importance of this basic infrastructure building, because it's not only about the AI factories, but everyday in computer IT infrastructure in the hospitals, in the basic healthcare, where quality of data will feed these AI algorithms, and then it will be expressed at the final quality of the product, either research or drug or anything that appears from AI use at the large scale. So this is what just I wanted to highlight, this investment in basic infrastructure to properly feed AI with high quality data.
Thanks so much, Darius. And that really fits in very nicely in the question that I had for you, Hammad, because I think Jean-Marc put it very well in his keynote remarks, from patchwork to platform. And I think my question to you is, how do we ensure indeed that we overcome the phase where indeed we invest in pilots, and how do we ensure we scale them up to the broader use in research? And I think especially when you think, for example, about support for diagnosis in hospitals. So how do we scale up, I think, in the first place, and how will this transform care models from your perspective?
First of all, thanks a lot for the invitation. I think very useful discussion, and I'm already learning a lot, right, based on all of your feedback. So super useful. And I think this is a very important question, right? Because the actual value of all of the AI tools, it really comes from the scaling, right? Because we're all what I call living a bit in the pilot land, right? We're doing a lot of pilots showing value, but it's on a limited scale. So the actual value is really going to be where we're going to really, shift the needle. It's from the scaling part, right? And to really understand first, how can we scale? I think we need to understand a bit better what are the current issues, right, around scaling currently, right? So I think the first one, as you might not be surprised, it's about the data access, the data, interoperability as well, which I will go into a bit more detail. So I think that's the first one. But linked to that, I think it's also about integration with the hospital systems, right? You can have the best AI tools, but if they are like a standalone tool with no integration, I mean, I don't think the doctors are going to be using two different tools, right, next to their actual core system. So, and I think sometimes we're a bit, naive purely from a research, or it's a cool concept, but it needs to be workable for the people that are going to use it, right? So how do we keep their needs, in the back of our head is going to be very crucial. So that's the first, I think, main barrier around data and, the integration into the workflows, right? The second is around, the regulatory framework. And I think we have a lot of bases there, especially here in Europe, which is great. But what we do find in reality is that sometimes there is an overlap in the regulation, and it sometimes becomes, especially for like, the startups of this world, right, very complex, right, on how to navigate there. But also, I think next to the regulation, it's about the contracting phase, right? So currently, I can give some examples later around some of the pilots and scale-ups we have done, right?
Please do, perhaps, but I
Yes.
think that it makes it also for the audience very understandable what challenges you face.
Yeah, absolutely. So I'll go into a couple of examples, right? What we have seen here there is that if you want to scale, you need to actually have contracting hospital by hospital, right? And what we essentially hope is that the European health data space can be kind of like an umbrella in the future where we can, that can help us to scale. And the contracting hospital per hospital, it's essentially, it all comes down to the trust piece as well, right? If people have like a much broader trust in the technology, that will go much quicker, and we will be able to scale things. And I will give an example, of course, also of the UK, right, where we were able to scale up things like you mentioned with the NHS in a centralized way. So those examples already exist. So those are the main two kind of like, barriers, right? And what can we do to essentially overcome the barriers, right? So I think the first piece around the data, it's about, I think the EHDS is a very good framework, right? But it's the devil is in the details, right? How do we implement, right? And I think we as an industry can also help, share our perspective and shape that, because that's essentially all we do, right? I represent J&J, and I work in what we call the regional organization. So I'm responsible for Europe, Middle East, Africa, but we work in a global context, right? So we are speaking every week to our colleagues from other, geographies. So we have found ways to, right, scale it. much more in other geographies than in Europe, right? So we can also help shape that technical implementation, right? And I think the more we can be involved as an industry, the better it's going to be, shaped. So I think that's first piece around the data. I think around the workflows, the collaboration with the partners, right? We have in the past, for example, for an ECG AI tool, right, collaborated with GE, right? So it's these kind of like partnerships, because those are the vendors that are there in the hospitals, right? So, and if you say, we are going to come with an algorithm, we don't care how you use it, yeah, there's going to be no adoption. It needs to be in the tool that people are using it day to day. And I think there also, what I feel a lot of the bigger medical device conglomerates, they're sometimes a bit scared, right, around the regulation. And anytime they want to scale up, it's the US first, and then they move to Europe, right? Just because, and I think that's something we need to tackle, and how we can, sit together with the broader industry. So not only pharma, but also the medical device, manufacturers, right? So that's how we can tackle the whole workflow, I think, issue as well. And I think the last piece is around, and I know there's already a lot of work going on around the regulation simplicity, right? That would really help us across the board, right? Both for the data, but I think also the implementation. So I think, just to summarize, that's a bit how we can really take it to the next level, and come out of the pilot land, right? So data integration into the systems, and working with the third parties of this world to take everything to a next level, essentially.
Thank you very much, Hammad. I think, Fulvia, that brings me back to you, because I understand that DG SANTE is also working on an upcoming study on AI in healthcare. And in that respect, I don't know if you already can say a few words about how you and your team have been working on this study, and what you see as the key challenges and accelerators when it comes to need to scaling up, any issues that Hammad was just bringing in.
Yes, thank you for the question. Indeed, we see a very similar. We have a very similar assessment to the one you just mentioned, meaning that in terms of innovation and prototypes and pilots, we have a lot. Now we need to move to the next step, which is deployment. And deployment is where indeed we are finalizing a study. Unfortunately, it's not yet published, but it is about looking at the obstacles that there at the moment, and the opportunities, of course, that we see in the further deployment of AI in the healthcare sector. Let me maybe start from the opportunity, because as I said, I have sort of a DNA. SANTE is to start from the passion, then you go to the research, and then only at the end you come to the competitiveness angle and market. But of course, this is also very important. I cannot forget my 20 years in DG Grow before joining the SANTE. So I know that, of course, and I'm very conscious of the fact that the HDS is also an incredible opportunity in terms of competitiveness and support for that industry that indeed in too many cases actually goes to the US or to other third countries to scale up their development. So the HDS is also indeed an instrument that, in our view, would reduce that fragmentation, facilitating what you said in terms of the reality that is today of connecting the hospitals, because it looks primary and secondary use seems like two different words, but in fact no, because it is by actually making the mandatory part on the primary use, so in basically creating the condition for the data for everybody to be connected, to be collected in the same format every day, then that you get those data ready for the secondary use, so and available for the secondary use. So and that obligation will apply to all the hospitals, and they would be able by flowing the data for the making the access free for the citizens everywhere they are in Europe. This will also force an additional interoperability amongst the hospitals, cross-border exchanges, and creating much more fluent flow of data within the countries and across borders. So the two parts of the HDS actually are really supporting each other. And the obstacles, I think we also very much see the same. So there is, first of all, a lack of this trust that I mentioned at the beginning is there. So there is a lot of not resistance, but let's say suspicious in the healthcare, in the citizens, and that's a joint work that we need to do it from a regulatory perspective, from an industry perspective, really to reassure, to train, to educate all the different stakeholders there. There is also a need to see how those technology can be integrated into the clinical processes and not coming on top. I think our colleagues at the beginning mentioned that this is not something that comes as a complement, but it's really has the potential to change, but only if you are open mind. I mean, is as a project, is an hospital manager, you going to be able to rethink your IT system, you know, with that in mind, because otherwise it must remain very user friendly. And that's something that we need to always to keep in mind. And I think on that we have a very good opportunities actually to work together with the vendors, with the industry side that knows very well, I mean, the market, that they know they are the ones, they are in daily contact with the users at the end of the day. So we have really an opportunity to work together in making something that actually works on a daily basis for the workforces, for the doctors, for the nurses, and then for the patient, of course, at the end of the day. So a big potential there, and indeed the study will be soon released. And but I think is very much in line with what you mentioned in terms of obstacles and challenges.
I think Hammad, you wanted to come in probably.
Yeah, just I think sharing. I mean, I live here in Belgium, right, and we work very closely with the larger university hospitals, right. And what we really see is that I think there needs to be a bit of a broader version, right, because they are really focused on delivering and making sure the systems are running, right. But they're and let's be very honest, I think it's about competitiveness. But let's also not forget, in 20 or 30 years time, this will really, whatever we are doing now, it will have really clinical outcomes impact, right. If there are other regions that are doing far better, we will see a difference there, right. So we really need to, and sometimes I think it becomes a bit of a theoretical discussion, but I think for me it's really about patient outcomes at the end of the day. And if we really kind of like make this a success, not only will this help us in the competitiveness, but it will make sure that the patient outcomes, because we're talking about preventive medicine, right, we're talking about personalized healthcare, and all of those things will be enabled by this technology, right. So I think there needs to be a bit of a broader long-term vision also at hospital level, that it's not about, okay, we need to make the systems running. Absolutely, that's important, right, but we need to be ready for the future. And that's where I see they are struggling really a lot at hospital level, really, like with the systems. And those are a lot of those are legacy systems, right, and we're talking about infrastructure, but the infrastructure at the hospital level is really also one key I would say issue to tackle as well. I mean, for all of us, right, together as a community.
That brings me back. I think I see you, Kyriacos, because I had a question to Simone, but let me also see again if in the audience already someone would like to. Yes, please. Yes.
I'm Martijn from the Taiwan office in the EU. I appreciate the EPC held this seminar. Is very important one. And I agree with Mr. Jean-Marc that the AI cannot replace the professional. It should be used by the professional. So it's very important to know what the professional want. So if you can link the professional from the user's perspective to the researcher, it's will be easy to develop a AI tool in the future. For example, the radiologists have to check thousands of medical imaging films every day to pick out some of the suspicious one. So if you can develop a software to help the radiologist to pick up some of the suspicious pictures, and that will be very helpful. So I think to link the user's perspective with the researcher is very important. Thank you.
Thank you very much. And that brings me indeed to the point that I wanted to make to Simone, because the AI Act exempts research. And especially when we speak not only indeed about healthcare professionals, but also the collaboration between industry that Hammad mentioned and researchers, this complicates collaboration. So what kind of clarity or safeguards would you need to ensure that researchers can navigate this space? And also the AI Act service desk, which again should be a tool that is helpful. What is your vision? Is it going to be helpful?
Yes, so thank you also for putting the question up with how to relink the researchers and the industry perspective, because there we have already ongoing really good initiatives. Think about the IHI, we talk about the global health initiatives that we see as well. So there's already discussions ongoing. In terms of the AI Act, of course, as you said, we're the using of AI for sole scientific purposes is excluded under the AI Act. But of course, as you all know, EU law wouldn't be EU law if there wouldn't be exemptions and twists and turns. So indeed, researchers can be also a provider because, for example, making AI systems available for academic purposes when collaborating with industry. So once it's being put on the market, then you would fall under the AI Act. So that's something that we also collaborate and inform our universities, but also the research institutions itself. So universities themselves can be providers, because if they want to collaborate with private stakeholders on, for example, traffic management and AI, so they're conducting the research, but then later on it will be applicable and being put into the open market. And then also we look into the deployer side, where research institutions can be, for example, using AI to assess students' performance and the assessment. So that's something that falls under the use cases of the AI Act. So that's something that we're very much aware of. And we have working groups within our organization that is composed of the heads of the digital departments of the respective universities. And these are questions we always aim to discuss. One thing you talked about, the AI service desk, I think it's a really good initiative to have this out there. It's really still need to be seen, obviously. There are now the call for tender, I believe, is out there for the commission to have an external team coming in to support the AI office, because obviously the AI office has a lot to do. There's still hiring processing, so that's really, really good. But one thing that I saw when reviewing everything, and I review everything very closely because the devil is in the detail, as you know, is that when looking into the call for tender in particular, it says that the AI service desk is for the AI systems operators. And then the operators are, and now I have to make sure, provider, product manufacturer, deployer, authorized representatives, importer, or distributor. So those are the ones that could access or ask questions to the AI service desk. But then if you are a researcher and you're conducting research on AI, you're formally excluded. So you're not necessarily an operator. Are we still able to ask, or are we basically being said, sorry, no, I know this will not probably happen, but this is something, if you look into the law, there are some questions that arise. And so I know that none of you here are working directly on the AI service desk, but these are things that would be good to know, because obviously once you have a researcher and they are conducting research and then they want to put it on the market at one point, we have, of course, the, let's say, the knowledge and technology transfer offices that can help them. But at one point also, they might have questions. So it's great that we have the service desk, but we want to make sure that we actually can use this. So that's on that, yeah.
I think that shows again that it's very much an area in development, where indeed also some of the recent tools like the AI office have just been set up, actually. So in that respect, it is important to also share this feedback probably with the Commission. But Martijn, I wanted to go back to you, because we already addressed the need for collaboration, but also having the right tools. And I think another important aspect is how to deal with sensitive data. And I know that you've been working in projects like Melody, double L, double D for the audience, in case you're interested, that develop machine learning models without sharing sensitive data. So I think with that in mind, could you indeed share lessons from that and how that translate to technical solutions that indeed all of us need to advance these discussions?
Yeah, I think it's very important. So I heard the word trust.
A little higher. I think that, or your button.
It's on. Sorry. So as I was saying, so indeed, I think technical solutions for enhanced privacy in AI can be very helpful. It will not be the only thing that is important in this field, but it's very important. And I have indeed been involved in a research project, Melody, where we applied a privacy preserving algorithm to be able, and it was in close collaboration with J&J also, where we applied this privacy preserving algorithm so that different partners in the consortium could learn a jointly trained model without explicitly sharing the data. And yeah, this is what they call federated learning. And I heard it also in the keynote speech that federated platforms are important to also enable trust, so that the data stays where the data owner is located. But we have technical solutions, but also legal solutions to be able to learn or get insights on the data, and at least share the insights, but not the data, because from the insights of the data we can of course learn a lot and move and apply it for real world use cases.
Well, thanks, Martijn. And Hammad, I don't know to what extent you would like to react on Melody, but I think my question to you is, and I think especially since indeed we had our speaker from Taiwan already referring to, let's say, the broader international context, where I think we also would need to see what is it that we can learn from other parts of the world. If you think about the AI continent action plan, what is it that we need to learn from other parts of the world when it comes to scalability of the issues that we're discussing today?
And I think the AI continent action plan, right? It's really the right step at the right time, right? And again, it comes down to really how we implement it and really leverage it, right? Essentially, I think we as an industry really see it as an opportunity, because healthcare is really, a significant part, right? It's a big part of that overall plan. And I think this is where, this is where we need to make the difference, right? With AI in the healthcare space. What I can already share is that, we as an industry, we really see it as an opportunity, right? But we also see that we have our role to also share some of the best practices that we have already seen, right? Because we work in that larger, broader international context. So some of the examples, perhaps, right? Let's move on to concrete examples, right? That we were able to already do. So I mean, I can give you an example of an algorithm that we developed a couple of years ago for a rare disease, right? So pulmonary arterial hypertension, right? It's a rare disease of heart and lungs. And what we were able to do is train, for the UK, a model, in collaboration with NHS, right? So fully, of course, fully compliant. And essentially, making sure that the privacy concerns are fully, that we don't have access to the data, but we are actually able to run a model on the data and get the outcomes, right? And the outcome was essentially, because, the colleague also made the comment around rare diseases, right? The biggest issue with rare diseases is they're very rare, right? So, they are not easy to detect. So, being able to find the patients, and what we were able to do, that model was able to do, is detect those patients, right? Where, we had a very high probability, not of course identify them, but really say, okay, in that county, so to that hospital, right? We see in that larger area, right? We see that many undiagnosed patients, right? And what we were then able to do is really do medical education for those hospitals, those HCPs on those patients are there in the hospital systems, right? We don't tell them which ones they are, but we help them to guide, okay, perhaps that's the easier way to detect them, right? And what we saw is remarkable results, right? We saw that the diagnosis of the patients really almost doubled in the regions where we actually did that reach out specifically. And we were able to, you know, implement that across whole of UK, because the advantage of working with one central body like NHS was the scaling across, you know, 50, 60 million patients. So we were able to find a lot of these undiagnosed patients that were otherwise perhaps we would have found them, but too late perhaps, right? In a later stage, and you know that's really saved lives, right? So that's why I always come back to it's always about the patients and the patient outcomes and what that allowed us to do essentially, right? So that's an example of UK. We were not able to roll the exact program across Europe because due to data availability was an issue. I do have another example, right, with where we did have another model that we did train in the US. So it was trained on a very large data set in the US, but we did implement it on European data through a data aggregator. So it's essentially a third party that had, you know, a lot of these hundreds of contracts with a lot of different hospitals, right? And we were able to do the same. We were able to run the model without having access to the data and get the outcomes, right? But again, the aggregator had perhaps a couple of hundred hospitals across whole of Europe instead of, you know, the full body, right? So there we were able to scale, but not to the extent that we would have liked to do. So those are some examples that we are doing them already in industry, like the colleague mentions, we are doing them in the research as well. We have found, you know, the ways to do it, but not at the scale that we would like to do. So the UK example is a very good example, right? That we were actually able to roll it out across all of UK, and you know we could really see the impact of that and how we were able to detect a lot of these patients a lot earlier for rare disease, which, you know, essentially makes all the difference. So those are a couple of, you know, concrete examples on that I would like to share from other, you know, geographies, that, you know, that for us the path forward is very clear, right? I think we just need a lot of the enablement to really happen, and for us it's about execution, right? So yeah, really, hopefully it's a bit of a perspective on what we're able to do already, you know, within the limited context, right, that we currently have.
Yeah, I think it's exactly these examples that we're looking for when we speak about scaling a bit. I think, Simone, I saw you nodding, so you probably also want to come in.
Yeah, I actually have a follow-up question on this because it sounds really fantastic that you have this opportunity and that you said that you use a data aggregator to also run this in the EU, in Europe, in European countries. Was this countries within the EU or was it then the UK? Okay. This was in countries in the EU. Okay. Okay, because then my question is now looking into the future with the European Health Data Space in place. We have the, I don't know if it's, Fulvia probably knows this better, but the obligation or the possibility to also inform then patients if they see certain diseases that were not previously diagnosed. How do you see that then working in the future on these things? Because that's obviously something that you are using the data, or you have the AI models from a different country, but then still you run it on the, and you gain outcomes being disease patterns, etc. How will that then work into this mechanisms of informing the patients that in case they have something, maybe if do I interpret that correctly? Yeah, great. So that would be great. Thank you.
So actually fully agree, right? And I think the reason we did not go to the patient level detail in the program exactly for the reason, right? And I think it was a couple of years back, so I think I'm also not fully sure what the regulation at that time exactly was. So what we did was do it at the hospital level, right? So we have essentially, you know, an internal view of this is where we see the biggest opportunity on underdiagnosis. So it was more not to have the decision making for the HCP, right? Because it was more internally where we need to target our medical education to actually, you know, at the hospital level say, you know, okay, we see there is still a lot of underdiagnosis that's happening here. So indeed, that's a bit of a difference between, you know, the secondary, right, and the primary, where primary, if you really have the integration, you can take it to the next level. But if you don't have that, you need to keep it a bit at a higher level, right? So we can, you know, internally at least form, and I think the biggest impact is really at the primary level, right? So that's how we kind of like, you know, worked with that at the hospital level, perhaps.
I have Fulvia, but Kyriacos, you also want to come in, so perhaps you clarify, and then indeed.
Sorry, very briefly on. Very briefly to clarify what the obligation is about, because it could be misleading. The obligation is indeed for the user, let's say, of the data. If he finds something which is significantly impacting question of life or the diagnosis in the context of his data, he has to communicate it to the relevant HDAP. But it doesn't go, of course, is always in the context of data which are anonymized or pseudonymized. So we will not be able to say, please inform this guy. I mean, only the HDAP would have the possibility, if needed, and according to national legislation, to decide whether or not there is an action to be taken. So just to be clear. So that kind of information will never be available to the researchers or the data users. Okay.
Thank you, Elizabeth. I wanted to briefly respond to our member of the audience from East Asia, it was, and also Thailand. Thank you. Taiwan, right, yes. And also utterly to Hammad as well. So we understand that in any regulated industry, healthcare being one, there are typically two high-level requirements for any IT system. One is productivity, the other one being compliance. So in that sense, absolutely, the point about workflow integration of new tools hasn't been lost on us at all. I cannot say much more than this, but in the funding instruments and calls to come, essentially that has been acknowledged, and it has been made very clearly to us. So essentially, we do not need an overflow of tools for our practitioners. They need solutions that work well for them in a simplified manner. And of course, workflow integration as a paradigm is very key. In that regard, we may see in future, and that is just a personal projection, we may see the requirement for one screen, given the proliferation of tools and the propositions for productivity. But at the same time, we do need to ensure that compliance is also addressed as a high-level requirement. That was all, I believe. Thank you.
Thanks, Kyriacos. Perhaps I stay with you, but let me first see if there's a comment or a question from the audience. Yes, please.
Hey, thank you so much for this event. My name is Giedra Pasitskita. I'm from Politico, and I wanted to ask Fulvia, because you mentioned many times how important is trust. So I wonder, what is Commission doing to ensure that there is trust in using AI solutions in healthcare, and how important is cybersecurity in this sense as well? Thank you.
Well, what I said until now, it is about setting a trust. So trust is something that you need to build on a daily basis. And that's what the work we're doing through the European health data space, which is at the, let's say, at the source of is taking care of the data that the AI appliances will be trained on. On the other side, of course, at the beginning of the chain, we have the AI Act, which is taking care of all the requirements that would be needed, in particular for healthcare systems, the AI systems that qualify as high risk under the AI Act. And by looking at the whole chain, we are really regulating the entire life cycle of an AI appliances from the beginning. The time is designed via the AI Act. To the moment is going to be trained and very much also qualifying and indicating in transparent and reliable way which data are going to be used. And then afterwards, once it's on the market, of course, if it does qualify as a medical device or not as an EHR systems. So in all the steps, we are ensuring a coherent approach that does actually provide that very clear, transparent, and reliable, let's say, approach to whatever is going to be in contact with the final user of the AI solution based. This is the EU approach. It may look a bit kind of too much because we have all these steps, but we are really looking at that in a very constructive and efficient and synergetic way. We think that this regulatory approach is really coherent, and we're working on a daily basis with the colleagues in DG CNECT to make it understandable and really fluent for the users. And we expect that to really provide that trust to the not only to the final users, but also to the ones that needs to invest in AI solution for the healthcare, because that's in many cases are public entities, Ministry of Health, or public hospitals, and they have to have this very solid reliances on the choice that they're going to make for the benefit of their own application. So the solid implementation of the different solid and coherent application of the regulation that we have in place is certainly a very important guarantees that that citizens and patients can trust the AI solutions which are on the market. And actually we are looking on how this could be also further deployed and uptaking, again, with in mind the benefits that they can bring for the citizens and patients.
Please come in, I think.
I can also comment a little bit from a technical perspective on the trust part. So I think so as a former AI researcher, I think what basically hurts trust the most is that AI or most of AI models are black box systems. So you have an input and something comes out, a prediction, but nobody understands where this prediction comes from. So what is still a field of research in AI, very important, is explainable AI. So where the AI model is not only able to give the predictions, but also able to explain how it came to these predictions. Because at the other end of the spectrum of computational models, you have these white box models, where the computational models are based on laws of physics we all understand. So mathematical equations that are implemented in computational models to simulate, for example, weather. So we really understand these kind of models, but the models, data-driven models, we less understand how things work. So I would, as a former AI researcher, I would really like the policy that we invest more in solutions for research programs for explainable AI, or even hybrid solutions where you can constrain, let's say, the predictions of these data-driven models with equations, like it's called in more technical terms, physics-informed neural networks, for example, where you constrain the models that it gives you predictions that only make sense in the real world. So I think these kind of initiatives can really also help to gain the trust of people.
Well, thanks. I think that that's very important. I know, Simone, that you want to come in, but I think that's also very important in the broader context where, of course, also different parts of the world take a different stance. And with tech companies in the US also largely dominating the discussion with indeed data as a business model, where indeed we don't know sufficiently what's being done with our data and how the model is actually constructed, which indeed leads to biases, etc., as we said in the beginning. So, Simone, I think you want to come in on that as well.
Thank you very much. You took kind of you served me my intervention on a silver platter, so thank you very much. So I think it's really a key what you said, that while of course there's a lot of research ongoing, and that especially the black box phenomenon that we have needs to be further researched. So that's definitely key, and this is what AI research are also doing at the moment. But it's also something to look into the intersectionality and the interdisciplinary research that can be done and should be done and is already being done on AI. So for example, one of our great benefits here that we see in our universities is the collaboration of disciplines. So if you look, for example, on the AI, let's say the very specific AI research, working together with social scientists and from arts and humanities sector to really understand also the impact that AI has on the society, which is something that not just having the high technology readiness level research, so the very straight going onto the market research, but really the basic, the fundamental research on AI, of what impact it has on our language, because obviously, as you know, you put a prompt in your general purpose AI model that you know, a large language, and then you basically have a very, it gives you the most probable next word, basically, that is based on what's out there and on the internet, obviously, to be very plain now. But then also you have to see that more, let's say, things are being generated through AI and being put online, that kind of makes the loop in itself in a way, now making it very simple. But the point is that we need to research on these elements as well, and how this will change ourselves, how we perceive our culture, etc. So it's really something that is already being researched on and really should be further invested on. And that's something that sets also Europe and European Union apart from the rest of other parts of the world, that we have this high value driven and very cultural diverse environment that we live in. So this is something where we can put ourselves apart. And so for those of you who are not necessarily following the AI in science developments, the colleagues from DGRTD are working currently also on the strategy for AI in science and the council conclusions. So the council is working on the council conclusion of AI in science, where we have, for example, are really pushing for this interdisciplinary research that really can set us apart from the rest of the world in that sense. So that's, thank you for putting the research perspective in there. So really following that as well. Thank you.
Thanks, Simone. And let me see also, Samuel, I'm just conscious that indeed we have also colleagues joining online. Are there any questions from the online audience? No? Anyone else? Yes, I see two questions. I think Arnaldo, perhaps first the question here, and then I think you yourself had a question, right?
Maybe very quickly, there was also a cybersecurity element on the question in the back from the journalist. So especially in EHDS, companies will deal with a vast number of data sets of patients, also proprietary data sets. Is the Commission thinking of doing anything there, providing training or anything?
Yes, cybersecurity is key, of course, is a key part of the trust strategy, let's say. For that part of the equation, we rely very much on the horizontal legislation that has been managed by the colleagues in DG CNECT. So the Cybersecurity Act, and then the other specific legislation, the NIS2 directive, etc., because the HDS will be fully integrated in hospital IT systems and national. So it does not really it is difficult to isolate, let's say, the HDS from the rest of the system. That was a discussion during the negotiation. I see my Dutch colleagues here, and there was a very, very clear indication from the member states that we need to look at cybersecurity as a whole in an horizontal way, and looking at cybersecurity of systems in first place, where of course the data management is it's a very important part of the pieces. We are of course within the regulations there are also specific references to security. These are actually they will become let's say the requirement for the eHealth system put on the market. They will have to be by 2029 fully interoperable and secure according to the requirements that we're going to set into the regulation. But let's say that the overall ideas is that those the accessibility and interoperability of data would be managed within larger systems. They are fully captured under the horizontal legislation managed by the colleagues. And we are, of course, working together after the action plan for the cybersecurity in healthcare and hospitals. This DG SANTE and DG CNECT have been working very much, and we are using all this channel to get aware the stakeholders, because we know that the human factor is actually one of the most important and weak point into the cybersecurity strategy. So while enhancing actually the putting together, let's say, trainings and educations and modules for enhancing the digital awareness and the digital skills of the healthcare sector, of course, we also keep very much cybersecurity in mind for that perspective.
And also just to add, for later this year, in the context of the Coalition for Health, Ethics and Society, we plan a publication on indeed cybersecurity in health. So watch this space, I'd say. But Arnaldo, I think you wanted to... Yeah, sure, absolutely.
In addition, you may have seen the cybersecurity plan for hospitals and healthcare providers in the EU. This was published in the first 100 days of the new Commission. So that plan does include proactive measures as well as reactive capacity building ones. In terms of proactive measures, so both are important for handling and managing cybersecurity. We do have many, if not all, the healthcare infrastructures we're building in DG CNECT. They have to comply with the so-called Article 12.6 of the Digital Europe program. That means that all the entities participating have to come from within the EU and be of EU interest, and that is very carefully checked. I can assure you of that. And of course, internally, we look at the cyber security aspects when it comes to the design of new cores and new projects on an ongoing basis. Simply said, we live in the world that cannot be overlooked. Thank you.
Arnaldo, and then we have Jean-Marc. Arnaldo, you're a member of my team. Very happy to have you come in.
Hello, good morning. My name is Arnaldo. I'm working on Elizabeth teams. And as we know, the AI is also taking data from the past, but at some point, this data is not really accurate, or most of the time ignores the fact of woman's body or social realities that we are suffering right now. So I was wondering how we can make sure that these new technologies, it doesn't repeat or even getting worse, the problem that we're trying to solve. And also regarding to this question as well, I was wondering probably if in the Commission, there's any initiative or any kind of plan to introduce more into the research area for young women to tackle this problem as well, because at some point it's a really good part if we want to understand what we're doing right now.
And thanks for the question. I think we can echo the well-known example from another world region where decisions about the care of individuals was actually done on a multi-input model, AI one, of the same type of data that was looking at healthcare expenditure of the individual citizen. And it turned out that based on a prioritization of how much money had been spent by that individual in terms of the healthcare, they were more highly prioritized for future care than anyone else who may not have been spending as much. This was a key revelation in that world region, and it really essentially a very weak point in essence in that AI model. So there are a few answers to the question as we see them from the evolving research in the field. One answer is the increasing use of multimodal data. So when AI foundation models in particular tend to take many more types of data about one single individual patient into account, then the predictions tend to be more accurate and indeed more holistic in terms of their needs of care. Perhaps we can leave it there and come back, but yeah.
Thanks, Kyriacos. Jean-Marc, and perhaps another, if you can get the mic to Jean-Marc.
Thank you. Just a couple of comments regarding the list of questions related to cybersecurity, AI skills for researchers, trust, and so on and so forth. So just to let you know that 1 year ago, following a dialogue with DG SANTE and a collaboration with DG CNECT, DG GROW, and DG Ampol, so for employment, we signed a specific agreement with under the umbrella of DG GROW, DG Ampol, CNECT, and SANTE to set up a new European partnership in health skills under the Pact for Skills. This new European partnerships focusing on health skills partnership is gonna deploying a set of concrete initiatives, out of which first one has been funded by Erasmus Plus Blueprint for strategic alliances, bridging the gap between industry and higher education institutions. And the scope of skills that are basically expected to be addressed by these new European partnerships are not only bioprocessing, biomanufacturing, but also digital literacy, AI skills, and cybersecurity on top of biomedical engineering, clinical development strategy, and so on and so forth. So focusing on cybersecurity, AI skills, and so on and so forth. We already launched a couple of key concrete initiatives like Bright Skills under Erasmus Plus Blueprint, developing a set of specific existing courses across higher education institutions, focusing on training researchers on AI, the way to use the Open Health Data Space set of rules and regulatory frameworks going forward, but also focusing on the industry sector from startups to large corporate industry to train targeted learners on existing courses. So to reply to your question, because it was one of your questions, Simone, we are working with higher education institutions. So, and by doing so, we are launching call for expression of interest under EITL's flagship call, looking for higher education institutions, whether it's about university, hospital, medical engineering, vocational education centers, business schools, and so on and so forth, along with some industry. Some of the industry players are having their own academy platform, you know, and we are working all together to develop or to repurpose existing courses or developing new set of courses to train healthcare professionals, researchers, and health industry workforces about AI, digital literacy, cybersecurity, and so on and so forth. So this is a concrete response going forward. And this is an EU initiative under the Pact for Skills umbrella. Going back to your questions, when it comes, how it's going to working at the member states level, and does it mean that the health data body are going to train researchers on the way to use the health data space in the near future? I would like to testimony a concrete benchmark as well. It's in the field of pilot landscape, let's say. Already existing initiatives are up and running, like I'm gonna sharing with you concrete case in France as an example. The Health Data Hub in France is basically the health data access body, which have been officially appointed by the Ministry of Health. And they are basically launching calls for expression of interest with within the ecosystems to identify universities or schools that are willing to develop set of courses, specific courses to train researchers on the way to use data within the health data as a health data access body, along with the data owner, which are university hospital or some specific or other data owner so far. So it's already up and running. And these kind of initiatives are under the pilot, which are led by DG SANTE, regarding the implementation of the open health data space. So it's already existing at the pilot phase again, and now we have to scale. Indeed, that's right. And the last comment is about your comment regarding the federated AI approach. I would say that it's already existing as well across Europe. So federated AI approaches and technologies are already up and running. And the magic, of these initiatives or kind of approach are basically making sure that the data are remaining at the data owner location. And the fact is basically that you have to make sure that the set of data are sufficiently standardized from a quality standpoint to train the machine learning systems across network of data repository. And the main issue is about the capacity to make available the high performance computing capacity in a distributed way across those set of data repositories so far.
Thanks, Jean-Marc, and that fits very nicely in my last question, because I am conscious of time. So I think I have one last question for each of you. And Simone, I start with you, so you also have the opportunity to react if you wanted to what Jean-Marc just said. Because again, we have been speaking about a lot of issues that basically come down to what do we call AI-ready healthcare systems? So I think my question to you, and again, this warrants almost an hour if you wanted to, but a short answer if possible. What would an AI-ready healthcare system look like in practice? So again, what are the steps perhaps that we need to take if we haven't taken them yet? So I start with you, Simone, so that I give the Commission, I think, as it should, the last word.
Okay, that's a very good question, but I want to go first on this because I actually want to throw in another EU initiative that recently was published and how that will feed into the overall ecosystem that you just described, which is the AI Skills Academy. Because there, again, it's more broader on AI skills and also sees that there will be a curricular that will be deployed at universities and also at least a generation of at least one bachelor or master program. So maybe we can discuss later, but how does that all fit into the existing skills bubble, if you want to say it? So food for thought for later. In terms of how can we make sure that the future healthcare system is future ready with all the AI developments, I think one of the key steps, we are researchers, we represent the researchers, that it's backed by scientific evidence, that it's not just deployed for the sake of deployment. It goes the same with using an AI system at a hospital setting because AI is now the new thing, but really making also sure that the system that is in place is fit for purpose. So just by throwing AI out there doesn't really mean that it's better in that sense. So that always needs to be in the mind of the future of the healthcare system. And in general, of course, we within the research community, we work a lot also with the member states or with the national government to provide with new insights, etc. And this should definitely be taken into account when developing new approaches, etc. So the close collaboration between not just the researchers and the government, but also within the society, so that it's all backed by scientific evidence. And I think for health, that's really important because you can't go out on a whim. The efficacy needs to be close to 100 because otherwise there's not much of a trust. And the medical technology industry knows that. So that's one of the things that I think it's one of the key points. So yeah, thank you.
Thanks, Simone. How about the industry's perspective on an AI-ready healthcare system?
Yes, like you mentioned, right, we can go on and on for hours, right? So I think a couple of very important things, and I'll repeat myself again just because it's a very important point. The first thing is about having the infrastructure, right, in place for us to be not only EHR or health records, but also the imaging piece, the genomics piece, right? It needs to be like a 360 view, right? And I think again, like I mentioned here, we are already in the industry experimenting scaling smaller level programs So we could, of course, share a lot of those frameworks or how we are dealing with the challenge there, right? So I think the infrastructure is a very key first concept to have, an AI ready, because without the infrastructure, both at at the hospital level, but also at the broader country level, right, you will not get anywhere. I think the second piece is about the governance frameworks, right, and about essentially how do we evaluate these technologies. And I think we already have a good regulatory framework there. But how do we also again build that trust, right? Which is quite which is the key to adoption for all of these. I think a third point would be around the skill level of the workforce, right? Essentially, the people that are going to be using a lot of these technologies in the future, right? They need to be comfortable with a lot of that, right? So it's linked to the governance, right? And still a lot of education that needs to happen where I would say it's a joint responsibility, right? We are doing a lot of medical education, but I think this in a broader context could also fit within that, right? So again, here, I think the industry could play a very big role on that. And last but not the least, of course, I think the overall ecosystem, innovation ecosystem, what I call, right? I think that's quite crucial. So not the hospitals, the industry, but also the startup world, right, that are going to really innovate in that space. That's going to be crucial, right? So I think how we get there, I think it has to be a public-private partnership and investment kind of like landscape in the infrastructure, but also I think from an education perspective, we need to play our role both towards the patients, but also towards the healthcare professionals that are going to be using all of that. So in a nutshell, I think infrastructure, right, the governance, and really making sure that we are doing the change management, right? Because let's not forget, it's change management process across the whole population, right? We're doing it all in our own companies or institutions, but it's essentially a very big change management process and program, and I think we all have a role to play in that. So that's a bit of the industry's perspective.
Thanks, Hammad. Martijn, with the current infrastructure that we have, but also with the recently announced investment in infrastructure, do we have what it takes to also catch up with other parts of the world and to become AI ready and have AI ready healthcare systems?
So yeah, I mean, AI ready, it's difficult to define what is AI ready, but yeah, it all starts, we heard it already a lot, with computational power. AI actually already existed for decades already in the field of computer science. In the beginning, it was all chess computers with computational power, just exhaustive search to all the combinations and get to a solution. Now, with more and more computational power, other algorithms are possible, like neural networks that in the beginning were not feasible because of lack of computational power. But with more computational power, other algorithms can be possible, like neural networks and transformer architectures. So these increasing demand of computational power is something we should be aware of, and makes it possible to do more advanced AI and launch with more advanced AI algorithms. So yeah, from EuroHPC perspective, I think it's computational power is very important. And with that, for the answer of your question, how is I think I think with the launch and of gigafactories, I think it's very important to be also a very important player in the world in this, because in the years we've been lagging a bit behind, but I think more and more we've come up with more and more infrastructure. But yeah, as I said, it's very important to have this infrastructure available.
Thanks, Martijn. Kyriacos, from a DG Connect perspective.
I would give a simple answer to this by one sentence, and I think an AI-ready healthcare system is a healthcare system where AI is well evidenced in terms of its safety and efficacy, taking into account the requirements, needs, and values of users and non-users, so patients, practitioners, families, carers, and others. Now, of course, that does describe the end state, and Fulvia talked about these steps. And there's a very good reason why we do have the steps, because I would put to you, AI is indeed the new opportunity, the new frontier, but we already have established best practice to guide adoption of any digital health technology. And in that regard, we do have the steps. We have proof of concepts, pilots, regulatory studies for regulatory approval, and then other forms of generating evidence for that gradual adoption in a safe and efficacious manner of any digital health technology. And part of the reason why we are in the land of pilots is because AI is quite new still. So we do have to be careful, wait, give it the time that it does deserve, given its promise, and essentially reach for that end state as a collective where we do have that body of evidence to guarantee the efficacious and safe use, just as we are as patients and members of our healthcare systems where we live, accustomed to MRI, CT, ultrasound, etc. Thank you.
Thanks, Kyriacos. Fulvia, DG SANTE.
Yes. Yes, a lot been said, and I think I agree with all my fellows panelists here. What I can say is that an AI ready healthcare sector is not the one they have the most. It's the one in quantitative terms. Is the healthcare sectors that actually ensure that AI really support the healthcare sectors, professionals, the patient and the citizens, and that it is applied also in a fair and very inclusive way. We don't want a few very fancy high technology hospital in Europe. We want really hospitals which are in Europe mostly public that actually do deliver the maximum for the patient and the citizens as well. That's where AI must fit, where AI can actually really support the transformation of the system and allow those all the practitioners and the to actually improve their working conditions, and at the end of the day, as the colleague said, the outcome for the patient. What I think is also important is, of course, it was not the focus of today, but is important to remind that requires investments. That requires investments at national level. This requires investments in infrastructures, digital infrastructure, and human resources across all sectors. The scarcity of the workforces today is a fact, and of course, as such, AI can support, but it is not going to be the solution, or at least not the silver bullet. So there's these AI solutions must be fully looked at in an overall, let's say, strategy to actually improve, modernize, and make our healthcare sectors more efficient and also more equal and solidar for everybody. Thank you.
Many thanks, all of you. This really brings us at the end of this conversation about best practices that we try to explore to also better understand how, on the one hand, indeed AI better informs healthcare systems, makes them more efficient, but above all, also improves patients' outcomes. And on the other hand, also to see indeed if the EU can live up to the AI vertical and the promises that brings for innovation and competitiveness. So it was a very rich discussion. So I really would like to thank all our speakers, starting with Jean-Marc. Many thanks for your opening remarks, but also all our panelists, Simone, Hammad, Martijn, Kyriacos, and Fulvia. Many thanks. As I said in the beginning, we really strive to have many different perspectives, and I think we managed indeed to reflect them in the discussion. So many thanks. I would say keep following the EPC, because not only has AI been very important for us already, but also recently we have been joined by my colleague Samuel Goodyear in my team, who is our AI fellow. So indeed, we're not only working on AI in health, but also the broader implications of AI for society. We're intending to work on AI in education and many more more topics. So if you haven't registered yet for the EPC's newsletter, please do so to follow what's upcoming. So many thanks again for our speakers. Please join me in thanking them very much for your efforts. Thank you very much.